Hello everyone, welcome back to my YouTube channel Community Medicine Essentials. In today's video, we will discuss intrauterine contraceptive device. It is one of the most commonly asked and high-yield topics in community medicine for MBBS, NEET PG, INI-CET and FMGE. Questions from IUCD are repeatedly seen from classification of IUDs, copper and hormonal IUDs, mechanisms of action, and lifespan, timing of insertion, from side effects and absolute contraindications. Let's start this topic. What is IUCD? IUCD is a small device. Inserted into the uterine cavity to prevent pregnancy. So it is a small device inserted into the uterine cavity to prevent pregnancy. It is a LARC method. Means it is long-acting reversible contraception method. Long-acting reversible contraception method. It is a spacing method. IUCD is a spacing method, not permanent. Now let's move on to the classification of IUCD. These are broadly classified into three types. You can remember this by the mnemonic NCH. N stands for non-medicated IUDs, C stands for copper-containing IUDs, and H stands for hormone-releasing IUDs. Copper and hormone-releasing IUDs are known as medicated or bioactive IUDs. So copper and hormone releasing IUDs are medicated or bioactive IUDs. Non-medicated IUDs are also known as inert IUDs. Non-medicated are also known as inert IUDs. These are first generation IUDs. These are available in different shapes like loops, coils, and rings. Examples are Grafenberg ring, and Lippes loop. Lippes loop is double S-shaped device. This is Lippes loop. These are now obsolete because of side effects and more expulsion rates. Now obsolete. Copper containing IUDs are second generation IUDs. These are second generation IUDs. Copper has a strong anti-fertility effect. Copper has a strong anti-fertility effect. Devices available are copper 7, copper T 200, copper T 220C, copper T 380A, Nova T, multi-load devices like copper 250 and copper 375. Copper T380A and Nova T has silver core. So copper T380A and Nova T have silver core. Numbers in the names of these devices. These numbers indicate surface area of copper. The numbers in the names of these devices indicate surface area of copper in square millimeter. Hormone releasing IUDs, these are known as third generation IUDs. Examples are progestasert and LNG20, also known as Mirena. Now we will compare the two commonly used copper bearing IUDs, copper T380A and multi-load copper 375. Surface area of copper in these devices is indicated by the numbers in the names of these devices. So copper T380A has 380 square millimeter surface area and multi-load has 375 square millimeter of copper. Shape of copper T380A is T shape and multi-load copper 375 is of inverted U shape. Inverted U shape. Copper wire in copper T380A is present both on vertical stem and horizontal arms. But in multi-load, it is present only on vertical stem. It is present only on vertical stem. Because copper T380A has copper on both vertical stem and horizontal arms, so it has greater copper surface area. Now, effective lifespan. Copper T380A provides protection for 10 years. Copper T380, 10 years, and multi-load is effective for 5 years only. Multi-load copper 375 is effective for 5 years only, and copper T380A is effective for 10 years. Now let us discuss third generation IUDs, also known as hormone releasing IUDs. Two important examples are progestasert and LNG20, also called Mirena. Both of these are T-shaped devices. Progestasert contains natural progesterone, (38 milligram of natural progesterone), and LNG20 or Mirena contains levonorgestrel, which is a potent synthetic steroid. It is a potent synthetic steroid. Then for progestasert, release rate is 65 microgram per day, and for Mirena or LNG20 it is 20 microgram per day. LNG20 20 microgram per day. Effective lifespan, progestasert has short lifespan of only 1 year, and Mirena has longer duration of action of 7 to 10 years. Then progestasert has lowest expulsion and removal rate among all IUDs. lowest expulsion and removal rates among all IUDs, but it has higher risk of ectopic pregnancy. And LNG-20 has lowest pregnancy rates. LNG-20 lowest pregnancy rate. Please remember it is 0.2 per 100 women years. And Mirena has lesser risk of ectopic pregnancy and reduced menstrual blood loss in comparison to copper IUDs. Reduced menstrual blood loss as compared to copper IUDs. We can summarize progestasert, natural progesterone, Mirena, levonorgestrel, potent synthetic steroid, release rate 65 microgram per day, here it is 20 microgram per day, effective lifespan 1 year, 7 to 10 years, and progestasert has higher ectopic pregnancy and levonorgestrel 20 on Mirena has lowest pregnancy rate and reduced menstrual blood loss. Next is mechanism of action of intrauterine contraceptive devices. First point to remember is that IUCDs do not inhibit ovulation. Do not inhibit ovulation. Copper IUDs hormonal IUDs. Copper IUDs mainly act by producing a foreign body reaction. Foreign body reaction inside the uterus. It causes enzymatic non-specific inflammatory response in endometrium. As a result, it decreases the chances of fertilization much more than implantation. It decreases the chances of fertilization much more than implantation. Another mechanism is role of copper ions. Copper ions decreases sperm motility. Copper ions decreases sperm motility. Hormonal IUDs. It is having progesterone. So these devices increases viscosity of cervical mucus. Increases viscosity of cervical mucus. So thus preventing sperm penetration and causes endometrial atrophy. So endometrium becomes thin and unfavorable for implantation. Take home messages: IUDs do not inhibit ovulation. Copper IUDs foreign body reaction, enzymatic non-specific inflammatory response, and copper ions decreases sperm motility. Hormonal IUDs increases viscosity of cervical mucus and causes endometrial atrophy. Now we will discuss the effective lifespan of various IUDs. Nova T and multi-load copper 375 both have an effective lifespan of 5 years. Most commonly used IUD in national program copper T380A provides protection for longest duration, that is 10 years. Progestasert has shortest duration of only 1 year. Mirena or LNG20 has long duration of 7 to 10 years. Easy trick to remember lifespan is in multi-load copper 375. Look at the last digit. It is 5. So multi-load copper 375, 5 years. Nova T has 5 letters. So 5 years. Progestas are pro but shortest duration. Pro but shortest duration 1 year. Mirena is miracle long. 7 to 10 years. Copper T388, this number ends with 0. So it is 10 years. Next is timing of IUCD insertion. In non-pregnant and non-lactating women of reproductive age group 15 to 49 years, it can be inserted during menses or within 10 days of start of menstrual cycle. Within 10 days of start of menstrual cycle. Post-placental insertion can be done within 10 minutes of delivery. Within 10 minutes of delivery. Postpartum insertion within 48 hours of vaginal delivery. Within 48 hours of vaginal delivery. During C-section, after placenta removal, and before closure of incision. This is called intracaesarean insertion. Intracaesarean insertion. Interval IUCD insertion if it is done any time 6 weeks after delivery. Post-abortion insertion if surgical abortion was done, then within 12 days of complete abortion. If medical abortion, then around day 15 of complete medical abortion. So, in non-pregnant and non-lactating women of reproductive age group, IUD can be inserted during menses or within 10 days of menstrual cycle, of start of menstrual cycle. Post-placental insertion done within 10 minutes of delivery. Postpartum insertion within 48 hours of vaginal delivery. If C-section was done, then after placenta removal and before closure of insertion. Before closure of incision. It is known as intracaesarean insertion. Interval IUCD insertion can be done anytime 6 weeks after delivery. Post-abortion, if surgical abortion was done, then within 12 days of complete abortion. Medical, then around day 15 of medical abortion. Next question is, when does fertility return after removal of IUCD? So, it returns immediately. It returns immediately after removal of IUCD. Then, next is, does IUCD act as an emergency contraceptive? Yes, it can act as an emergency contraceptive if inserted within 5 days of unprotected intercourse. If inserted within 5 days of unprotected intercourse. Now we will discuss who is an ideal IUD candidate. An ideal IUD candidate is a woman in reproductive age group. Woman in reproductive age group that is 15 to 49 years. She should have given birth to at least one child. Given birth to at least one child. There should be no history of pelvic inflammatory disease, as it can increase the risk of ascending infection in such cases. She should have normal menstrual cycles. Then women should be willing to check IUD thread, willing to check IUD thread, as it helps in detection of expulsion or displacement. Then she should be willing to come for follow-up visits. Willing to come for follow-up visits. Finally, the ideal IUD candidate is one who is in a stable monogamous relationship. In monogamous relationship. So in summary, ideal IUD candidate is Paris, PID free, periods normal, patient compliant, and partner stable. Next is, what are the side effects of IUCD? The most common side effect is bleeding. It usually settles in 1 to 2 months. For bleeding, iron tablets should be given in the dose of 200 milligram ferrous sulfate TDS if bleeding persists or heavy. Then IUCD should be removed. Second most common side effect is pain. Mild pain can be managed with analgesics. However, if pain persists or intolerable, then IUCD removal is indicated. Pain is most common reason for removal of IUD. Other important side effects are pelvic inflammatory disease, uterine perforation, ectopic pregnancy. However, the rate of ectopic pregnancy is lower in levonorgestrel IUD and copper T380A as compared to non-contraceptive users. While progesterone has higher ectopic pregnancy rate. Progesterone higher ectopic pregnancy rate. If a woman becomes pregnant with IUCD in situ, medical termination of pregnancy is advised. But if woman wishes to continue pregnancy, and threats are visible, IUCD should be gently removed. Gently remove IUCD. Absolute contraindications for IUCD insertion include suspected pregnancy, current PID, unexplained vaginal bleeding, cancer of uterus or cervix, previous ectopic pregnancy. Previous ectopic pregnancy. In all these conditions, IUCD should be strictly avoided. To remember cancer of uterus or cervix, easy way is IUCD. IUCD has U and C. In U and C, if there is cancer, no IUCD. You can remember absolute contraindications by the mnemonic P square BCE. IUCD should be removed in the situations like uterine perforation, pregnancy with IUCD in situ, menopause, intolerable pain, heavy or persistent bleeding, woman wants another child, when effective lifespan is over, Next is, apart from contraception, IUCD has important non-contraceptive benefits also. IUD prevents adhesion after excision of septum of uterus. So it prevents adhesion after excision of septum of uterus. Then hormonal IUD. Hormonal IUD is useful in treatment of menorrhagia, endometrial hyperplasia, endometriosis, fibroid, adenomyosis. So what is common in these conditions? Menorrhagia, endometrial hyperplasia, endometriosis, fibroid, adenomyosis. These are estrogen-dependent endometrial pathology. And in hormonal IUDs, there is progesterone which suppress endometrial proliferation. So this is all about IUCD, and in this video we have discussed most of the important, frequently asked and high yield points related to this topic. If you find this video useful, please do like and share the video and subscribe to the channel for more such high yield topics. In the next video, we will be discussing MCQs on IUD, which will further boost your preparation. Until then, keep learning and take care. See you in the